friends, we will discuss about chronic rheumatic heart disease. Chronic valvular heart disease develops in at least half of those affected by rheumatic fever with carditis. Two-thirds of cases occur in women. Some episodes of rheumatic fever pass unrecognized, and it is possible to elicit a history of rheumatic fever or chorea in only about half of all patients with chronic rheumatic heart disease. The mitral valve is affected in more than 90% of cases. The aortic valve is the next most frequently involved, followed by the tricuspid and then the pulmonary valve. Isolated mitral stenosis accounts for about 25% of all cases, and an additional 40% have mixed mitral stenosis and regurgitation. Now the pathogenesis. The main pathological process in chronic rheumatic heart disease is progressive fibrosis. The heart valves are predominantly affected, but involvement of the pericardium and myocardium also occurs and may contribute to heart failure and conduction disorders. Fusion of the mitral valve commissures and shortening of the chorda tendineae may lead to mitral stenosis with or without regurgitation. Similar changes in the aortic and tricuspid valves produce distortion and rigidity of the cusps, leading to stenosis and regurgitation. Once a valve has been damaged, the altered hemodynamic stresses perpetuate and extend the damage, even in the absence of a continuing rheumatic process. Thank you, friends.